Jitendra Patel, practicing consultant physician and diabetologist at Bluetree Nursing Home in Ahmedabad since last 30 years. First of all, congratulations Dr. Bansi Sabu and his team for successful organization of RSSDI 2021, and thank you for inviting me to chair the very important topic on technology symposiums which I have chaired just right now. So I would like to highlight few things about the digital technology in the field of diabetes treatment. And the first of all, the new technology which I came to know in today's conference is twin technology, which is going to be a very useful and the boomerangs in the field of diabetes, which is like the same Tesla technology has been used in the human health industries for the first time, and which is going to be monitoring not only diabetes perspective, the treatments and the diabetes related complications like hyperglycemia, but it's going to monitor each and every systems of the body, health systems, so your metabolic system, your food, your glycemic variabilities, and even your lifestyle and exercise related issues has been monitored with this technology, which is where newer things in the India, but is going to be available soon and going to be cost nearly around 1 lakh rupees for the whole packages for the patients. Then second new things related to the apps, which lots of apps is available in the markets, particularly for monitoring the diabetes patients. So digital diabetes clinic is a new concept. We all are aware about the EMRs, electronic medical records for the field of diabetes. And with the help of the apps, we can monitor lots of things and we can prevent lots of major microvascular and microvascular complications of our patients. So with this app, we can communicate the patients from the distance. There are lots of advantages and some drawbacks also of this digital technology, which is server based, and data security is the issues, and availability of the internet and the regional language. These 3-4 things are the big issues of the digital technology. But with COVID pandemic, we have understood very clearly in last 2 years that this telemedicine platform is going to be a newer and newer things, and now it has been approved by the MCI also. So I would like to just convey my message to my all friends who are practicing in field of diabetes. This is the newer things which I would like to share on this RSSDI TV medium. Thank you very much.